sepsis coding guidelines. Before going to start my session, all we have to know what is the sepsis. Sepsis is life-threatening condition of the infection. Okay, due to the sepsis. Okay, I'm reading that definition. Sepsis is potential life-threatening complication of infection. Okay, it is life-threatening complication due to sepsis due to might be organ failure like respiratory failure, liver failure, heart failure. Okay, urinary failure, might be kidney failure. Okay, if infection is more severe, sepsis is more severe, in that organ dysfunction might be happen. Okay, so we should not report like symptoms. Symptoms include fever, difficulty breathing, low blood pressure, fast heart rate, mental confusions, and decreased urine output. So when having the sepsis, no need to report fever. Anyway, we know it, right? Any infection is having, no need to report fever. If it is respiratory abnormality, we no need to report difficulty breathing, etc. Right? Low blood pressure, BP. So no need to report these type of symptoms when having sepsis. Coming into the sepsis coding guidelines, so all we know when having, okay, I'm reading the definition of the guidelines of the sepsis. For a diagnosis of sepsis, assign the appropriate code for the underlying systemic infection. If the type of infection or casual organism is not further specified, assign code A41.9 sepsis unspecified organism. Okay, so if organism in assessment plan, provider assessment plan is documented sepsis, then no documentation of underlying systemic infection. Okay, then underlying systemic there is no organism. Okay, provided is not document any type of the organism, then we have to code A41.9 sepsis code. So here you can read, you can see this, right? I'm going to the back slide. Sorry. Okay, so sepsis coding guidelines, like if organism is documented sepsis due to Acetobacter bacillum, sepsis due to anaerobes, sepsis due to any candidal, then we have a more specific code. Provider should be document in, organism should be document in our report, then we have a more specific code. If organism is not specified, only sepsis is documented, then we have to code that is unspecified, A41.9. That's it, the sepsis coding guidelines. If organism specified, then we have to code more specific code. There is no organism not specified, then we have to code unspecified. This is the example of IC10 index. Sepsis unspecified organism, sepsis due to more specific code. Okay, going to next slide. This is the IC10 index. Okay, sepsis, this is unspecified organism, that is code A41.9. These are all are more specific code, A category code. Okay, is it clear? What is guidelines is stating? For diagnosis sepsis, assign appropriate code for the underlying systemic infection. If the type of infection or casual organism not specified, further specified, assign code A41.9. That's it. Coming into the urosepsis. As per the index, there is no default code. As per the alphabetic index, there is no default code for the urosepsis. Then we have to query with the provider, because sepsis is there, right? Might be confused. Might be patient have, we also assume patient having sepsis, but urosepsis, provider assessment plan is documented urosepsis, then never to assign any code. We don't have any code for that, then we have to query with the provider. This is a sepsis guideline. Coming into the severe sepsis. Severe sepsis required minimum 2 codes. Severe sepsis required minimum 2 codes. That is under an organism A41 category code. If organism don't know, that code is A41.9. Unspecified sepsis code along with severe sepsis code. These 2 codes are required. Sepsis, severe sepsis. These 2 codes are required to report severe sepsis. Always primary code sepsis, A category code. If organism known, then we have a more specific code. If provider is not specified any type of the organism, then we have to code A41.9 unspecified code. Is it clear? Severe sepsis required minimum of 2 codes. First code for the underlying system is infection, followed by code subcategory R65.2. First code is sepsis, followed by the R65.2 code. Underlying systemic infection, followed by the severe sepsis code. If the casual organism is not documented as an A41.9, sepsis unspecified organism for the infection. Additional code associated acute organ dysfunction. We can assign 2 codes we have to code if provided documented assessment plan sepsis due to acute organ dysfunction. Okay, failure. Then we have to assign third code. As per the sequencing, third code would be respiratory failure, either kidney failure or the heart failure, anything. Okay. First code, A code, followed by the R code, followed by the acute organ dysfunction if document the support. Is it clear? Severe sepsis. Severe sepsis always 2 codes are required, that is A code followed by the R code. Sepsis and severe sepsis. If documentation is support acute organ dysfunction, then we have to add additional diagnosis, that is. Okay. Is it clear? Then coming into the septic shock. Here also 2 codes are required. In septic shock also 2 codes are required. Systemic infection should be sequenced first, followed by the R65.21 septic shock code. Never to report R65.2 as a primary. We have to assign always systemic infection code, that is sepsis code A41 category code, followed by the R65.21. If severe sepsis with septic shock, if documented in assessment plan, we have a code T8112. Severe sepsis with septic shock. Okay, documented, then we have a code T18 category, T81 category code. We have to report, that is third code. If organ dysfunction also documented, then we have to report additional. Is it clear? Right. This is sepsis, severe sepsis coding guidelines. Please like and subscribe my channel. Thank you very much for watching this video. I will update more and more videos regarding